Hi, I'm Dr. Abha Bhat. I'm a consultant gynecologist and fertility specialist at Herts and Essex Fertility Center. I'm going to talk to you about male infertility and semen analysis today. Male infertility is often overlooked. Many people don't know that in over 50% of couples who are struggling to conceive, male factors can at least contribute partially to the problem. That is almost half of the people. Yet it's rarely discussed. I've seen couples where the woman has been through scores of blood tests, has been poked and prodded, even has undergone invasive procedures like laparoscopies without the male partner having had a basic semen analysis. This should stop. It's important to give equal care and attention to male fertility. So what exactly is semen analysis? Semen analysis is the testing of ejaculate after a 2 to 5 days abstinence period. The ejaculate is allowed to liquefy and then examined under the microscope. Mainly, we look for volume of the ejaculate, the concentration of sperms in the ejaculate, the percentage of sperms that are swimming and how well they're swimming, and morphology, which refers to the structure of the sperm present in the sample. What's interesting is that a healthy male may produce as many as 1,500 sperms per second. That amounts to almost 100 million sperms a day. But it's not the numbers that counts. What matters much more is whether the sperms that are being produced are able to fertilize an egg. And that's what's important. You may have had a semen analysis which was reported abnormal. This does not mean that you're infertile. We will look at the whole scenario before deciding what the next step is. You may be asked to repeat the semen analysis before we make a plan. This may be after a few weeks. Also, the numbers, as I previously mentioned, doesn't really mean real life fertility. You may have a normal count, normal motility, and normal morphology, and still face a challenge in getting pregnancy. But at the same time, we see men who have lower count or motility getting their partners pregnant with no problems at all. The three main issues that we can find in a semen analysis is oligospermia, which means the number of sperms is less than what is considered normal. Currently, that standard is 16 million per milliliter of the ejaculate. The second abnormality may be asthenospermia, which means less than a normal percentage of sperms are moving. Currently, the standard is 30%. So 30% of sperms should be moving. They may be moving fast or slow, and this is combined together. The third type of abnormality that may be diagnosed is teratospermia, which means less than 4% of the sperms have a normal structure as dictated by strict criteria, which we call Kruger's strict criteria. You may have a sperm analysis which has a combination of more than one abnormality, such as there may be a lower sperm count and a lower motility, or you may have a problem with all three parameters. What's important to realize is that these parameters do go up and down in almost all men, as these are affected by your lifestyle, a recent illness, or even how you collect the ejaculate. So it's really important to look at the whole picture rather than jump to conclusions and getting worried. It's important to take a look at your lifestyle and follow a healthy lifestyle, which includes some sort of a fitness regime, a good diet, such as a Mediterranean diet with lots of vegetables, olive oil, nuts, and whole grains. Avoiding smoking, alcohol, and recreational drugs. It's also equally important to avoid testosterone supplements, as contrary to popular belief, this has a direct impact on the production of sperms and may actually render you infertile. After semen analysis, you may be advised to take male fertility supplements and antioxidants that may help improving your sperm parameters. And most importantly, you should know that there are always treatments available in almost all conditions. And this may include either intrauterine insemination or IVF or ICSI. And this will depend on the whole picture. That includes not just your sperm parameters, but also the specific details concerning your partner and how long you've been trying to conceive. So male infertility is essential to be diagnosed, and it's treatable. And that is the takeaway message I want to give to you today. If you're thinking of conceiving in future or you're currently trying, think about it, get some advice, get a semen analysis which costs less than a dinner date, and take control of your fertility journey. Thank you. Bye-bye.